Perfect. Hello, my name is Kelvin. I'm from Latin MH. I'm capacity building assistant here. And we'll be together in this meeting. It's the 7th study group of Latin MH. We'll be debating depression and the Pandora study. Here with me is Dr. Andréa Tenório. She is researcher here at FMUSP, Faculdade de Medicina da USP, at the Preventive Medicine Department. Also, she is a professor at Faculdade Santa Marcelina here in São Paulo too, and she is our capacity building coordinator here. Now she's with the word. She will be talk about the Pandora study, and I hope you have a good session.
Thank you, Kelvin. Thank you for having me here. Good afternoon, everyone. I'm Andréa Tenório. I'm a family doctor, and I've been working with this issue, mental health of primary care workers, since my master's degree, and the Pandora study is my PhD study here in the Department of Preventive Medicine, University of São Paulo. And today I will present the part related to depression and work-related characteristics. So the papers that I will present here are the first papers related to the Pandora study. Okay, so here in Brazil, the Ministry of Health created the Family Health Program in 1994. Each Family Health Program team is composed of one doctor, one nurse, one or two nursing assistants, 4 to 6 community health workers. This is my first team. I'm here a long time ago. So, just to have an idea, the progression of the implementation of primary care teams in Brazil, family health program teams. In 1995, in Brazil, we had 700, and today we have more than 4,000 of primary care across the country. So, the Pandora study was carried out in the city of São Paulo. The city of São Paulo is the largest urban area in South America. And today, we have more than 11 million people. It's a city with a wide social and health inequalities. Each family health program team delivered care to 3,000 to 4,000 people. So we have this area that we need to deliver care. We are responsible for the care of this entire population. So here some photos of the areas that we work, and these professionals, family health program professionals, work within the communities. So another area in another region of the city of São Paulo, our population, and some specific groups. Here the immigrants from Bolivia, and people who live in some collective places. So, this work, the Pandora study, in fact, derives from another research. After 3 years that I was working in family health program, my colleagues started to present mental health disorders and to have sick leave from their work. So we started to investigate community health workers. And it was my master's degree. So we published a paper, Burnout Syndrome and Common Mental Disorders among Community-Based Health Agents. So after this research, we observed that the rates, the prevalence of common mental disorders was too high. And we wondering if it would be interesting to investigate the other professionals. So we decided to perform the PANDORA study and invite the entire team of family health program to participate. So we investigate doctors, nurses, nursing assistants, and community health workers. We investigate teams from the city, in the city of São Paulo, and our sample was composed of almost 3,000 participants. We had a very high response rate, 90%, and we investigate six primary care centers and assessed 351 teams. So the results. The mean age of our participants was almost 37 years, and the majority was women and community health workers, 6%. So in this presentation, I will focus on depression, and we find high prevalence of depressive symptoms and also probable major depression. And community health workers present the higher prevalence, and this prevalence is higher than the prevalence observed in a population-based study, the megacity study. The megacity study found a prevalence of 9.4%. The prevalence among primary care workers is almost twice the prevalence of the population they take care. Regarding work-related variables, we found that community health workers was the profession most likely to present probable major depression. Other work-related variable was the length of employment. After 2 years, we observed the association increase. So after 6 years, the adjusted odds ratio was 2.3. Also, other variable related to work is the lack of feedback from supervisor. And also low social support from the colleagues and from the supervisor too. We evaluated the job stress scale and the job strain linked to the demand control model. And we found association with passive job, low demand, low control. Active job, which is characterized by high demand and high control, and active and high strain job, which present high demand and low control. High strain job presented the highest adjusted odds ratio, 6.7. Okay. With respect to violence, to exposure to violence at work, in the previous 12 months, we found the frequency of exposure was 60%. This frequency is higher than some researchers found in Rio de Janeiro, that was 46%, related to a WHO 7-country investigation about violence at work in health settings, in health service. So we investigate insults, threats, physical aggression, and witnessing violence. This is the first study to investigate this kind of exposure in entire primary care teams, including community health workers. In our sample, physicians and nurses presented higher chance to be threatened, and community health workers higher chance to witnessing violence. The frequency of exposure to violence at work was strongly associated with depressive symptoms and probably major depression. In addition, the association was progressively high. So we have here for probably major depression, the exposure to one type presented the adjusted odds ratio 1.8, and for 4 types adjusted odds ratio 14. I will present you the implications. Our finding had implications for stakeholders, policymakers, and professionals, healthcare professionals, and also for the population. So we have considered the repercussions of direct and indirect consequences of depression. For instance, we have turnover, we have absenteeism, we have low quality of care, we have suicide, and so on and so forth. So the implications, for example, for policymakers, what we suggest is we need to create strategies to deliver care to primary care workers with depression, facilitating diagnosis and access to effective treatment, and reducing stigma. Create programs to enhance managerial skills, training leadership aspects, for example, giving efficient performance feedback, increasing job autonomy, to create an atmosphere to a better teamwork, enhance social support, and strategies to prevent exposure to violence at work. So this is our first paper. The PANDORA study has this paper published, mainly describing the association between the exposure to violence at work and depression. And we have also this second paper, focused on work-related characteristics and its association with depression. So, I would like to say thank you to everyone and to open for questions and some comments. I can see some comments here. And Tiago. It's a question about longitudinality. In fact, we did not investigate these aspects, but one point that could be related is the length of employment. We study here the length of employment, and when we stay more than 2 years in family health, work in the family health program, you can see here higher odds ratio. And you see, after 6 years, it's too high, 2.3, and maybe it can show some intersection with longitudinality. But one thing is important for us, family doctors. We investigated the number of population, the number of people enrolled per team, and we did not find association between the number of people enrolled, and the level of depression. So it means there are other aspects related to work in family health teams that explain depression much more than the number of patients. So, Ana Paula, are you? The sound's okay? Presently we are working on the analysis of burnout and what would be the work-related variables associated with burnout that we could create interventions to mitigate the effects of burnout and depression among primary care workers. We need to remember that primary care workers are considered the gatekeepers of health systems all over the world. So, those workers hypothetically should provide accessibility, functionality, and if we can endanger, in fact, the entire health system, not only in the primary care, because we have this kind of outcome among the primary care workers. So our finds are of great concern. And we also will analyze all the work-related aspects. For instance, perception of organizational justice and bullying at work. So, as soon as possible, we will provide the papers to discuss and to have more information about what would be the variables related to work that we could create some intervention in order to avoid, to prevent depression, mental health disorders, depression, and also burnout. Great. Tiago wrote here that Marília Medical School, they create a primary care service to deliver care for the workers at hospital, but for the primary care workers or health workers in the hospitals. I'm already with Ana Paula. I don't know if she's already. Okay, solve the problem. Okay. Sometimes what we notice as the team, the doctor of the team, provide care for example, community health workers. What is very complicated and complex because they are in the same team. So some strategy need to be thought and implemented. Okay, workers from hospital service. But when in Marília, when you have some family health team professional with some kind of mental disorders, to whom this professional will search for help. Okay. If you have someone in the family health team with mental health problems, who else they can ask for help? Okay. Find help emergency. They used to find help at emergency and psychiatric urgency. Yes. Okay. Here. Okay. Thank you, Ana Paula, for being here with us. Okay. So presently we are preparing a report to our providers here and also to our policymakers here in São Paulo, the city of São Paulo. For the city hall, okay. Kelvin's helped me here because I'm new in this. Okay. Okay. I think the way I see it, it's really important to highlight this matter. It's really important to call attention for this issue, the mental health of primary care workers. It can endanger the efficiency of the entire system. So, thank you, Thiago. Thank you very much. And let's keep in touch. Okay. Thank you, Thiago. Oh, thank you, Kelvin, for having me here. Thank you, Latin Age. And those who want to give me some information or question, please mail me. And have a nice day. Bye, everyone.